Hello, everyone, and welcome back to another episode of the show. Joining me today to discuss how his province is handling the COVID-19 pandemic and the newly formed Omicron variant, as well as the rollout of booster shots, is Nova Scotia Premier Tim Houston. Premier, first of all, it's the first time you and I have had the opportunity to chat since you've been elected, so congratulations. And just moving into speaking a little bit about, I believe you requested the assistance of the military to help with the booster rollout. Speaking a little bit about just a general update on kind of where that's at.
Absolutely. Thanks for having me on the show. I'm happy to be back. I was leader of the opposition last time I was here, so a little bit's changed in my world, but happy to be back. And certainly the new variant is causing a lot of anxiety, a lot of stress, and a lot of fear, quite frankly, across the country and around the world. And Nova Scotia is no exception. So we have a real push to get the boosters in the arms, no question about that. Our vaccination rates are pretty high. We're still encouraging people get vaccinated. If you first dose, second dose, booster, whatever it is, get your vaccination. It protects you, it protects your family, protects your community. So in general, I think we have about 91 or 92% of Nova Scotians have at least one dose. So that's good, but we'll keep pushing higher. Now, the urgency right now is around the boosters, of course. So we need to get boosters into the arms of Nova Scotians. So we feel the urgency. We put a big push on. We've opened up a few 100,000 appointments for the month of January. We're following the NACI recommendation, so you have to be at least 6 months since your second dose. And we're focusing on people that are 30 years old and up. So we did put a call out to the federal government. We're looking for some assistance with. We have the doses. I'm very appreciative of the federal government. They've made this supply available. The next hurdle is actually the people to do the injection. So we put a call out for volunteers across the province, people that might be retired or have the necessary health training. We also reached out to the federal government and we've been talking back and forth, and they're gonna step up and help us out here with send some people I think are from the Red Cross as opposed to the military, but some healthcare professionals that will come to Nova Scotia and help get those doses into the arms of Nova Scotians. So we're thankful for that, but we feel the urgency to open up more appointments. People want to get their booster.
And it was just last week that the federal health minister talking about how he thinks it's time for provinces to consider implementing mandatory vaccination. There's been numerous provinces, Alberta and Saskatchewan, have already said no, that they're not going to consider that. But for the most part, it doesn't seem like many provinces are commenting on that just yet. Does your government have a view on that yet? And is that something you would move forward with?
Yeah, we've talked to, I certainly saw the federal minister talking about that. I've actually had a chance to meet with the federal minister, and he is an incredibly impressive person. There's no question about that. But, I've talked to our public health team here in Nova Scotia, and we just don't think that that's something that's necessary. As I said, our vaccination rates are high. Nova Scotians have been, we want to get them higher. There's no question. And there's some people who won't get vaccinated. We want to work with them, provide the education and see if we can get them there. But making it mandatory is not something that's on our radar right now. But certainly, as it stands right now, getting the COVID vaccination or not is a choice. But your choice has ramifications. So if you are not vaccinated, you can't go to restaurants, you can't go to public events. So it's your choice, but your choice has ramifications, and I think that that's kind of where we're at right now.
You mentioned sort of the education, part of it, and then you mentioned earlier too that you think it's 91% of people that have one dose of the vaccine, which does still mean that around 10% of people don't have even a first dose of the vaccine. So just touch on it, more about how you plan to educate people further to get their first dose first, and then obviously their second dose and then their booster.
Yeah, I think, and when you think about that percentage that doesn't have any doses yet, some of that is age based. They might be under 5, or they might be in that 5 to 11 category, which which we're still kind of working through. So, but I've spoke to people who have a bit of fear over they've seen some things on social media, or they've seen some of the adverse effects that people talk about. So they're just nervous. So when you talk to them, so we've done things like just making sure that people have the support when they're that somebody's there with them. They can talk to somebody about, they can ask their questions and get them answered. But the vaccines work. The vaccines are effective. And honestly, I don't know where we would with this variant and how many cases we're seeing. If people weren't, if we didn't have so many people vaccinated, I don't know, how severe those cases would be, because there's no question the vaccines are effective. So we want people to get vaccinated. We encourage people to get vaccinated. It's the best thing to do. If they have questions, they should ask those questions and talk to somebody about it. But getting vaccinated is the way you keep yourself safe and your family safe.
The federal government announced 140 million rapid tests that would go to the various provinces and territories. For the portion of those rapid tests that will come to Nova Scotia, how do you plan to distribute them to various settings?
Yeah, Nova Scotia has been a leader in testing. Since the beginning, we asked Nova Scotians to test, and we did that so we can they could have some sense of how much COVID was around. So we did a lot of asymptomatic testing, did a lot of testing at various over the last couple of years. But now the world's changed, the variant has changed. So we're asking Nova Scotians to be more focused on their testing, and there is a limited number of tests. There's no question about that. So we need to be very focused on how we use them. So we have an order in ourselves for some. We expected more rapid tests to arrive before the end of December, but supply chain issues are not here yet. But the federal government has procured. Yeah, I think it was 140 million. I think, as you said, so we'll get a share of that. So it'll be focused on where we see the higher risk communities, maybe healthcare workers, maybe those on the front lines. There will be some where we have an outbreak, some testing like that, long-term care facilities, these types of places. So we have a very focused testing plan right now. It's a mindset shift for Nova Scotians who have gotten used to just going for a test on their way somewhere. Oh, there's a testing station, let me get one. Now it's very focused testing. So we're very, very proud of the way Nova Scotians have stepped up at the various stages during this pandemic, and I know they'll continue to do that.
And I mean, there's lots of other jurisdictions in Canada, just as a final question, who have, basically not allowed people to get PCR tests or rapid tests because of how short supply they are. Now, obviously, you mentioned that there are limited tests in Nova Scotia, but how much do you fear that that Nova Scotia could end up in a similar situation? For example, as in Ontario, where they had to stop giving PCR tests to people unless you're symptomatic, and they had to stop giving PCR tests to people sort of just for giving them to them.
Yeah, we've also done that. We've also put some criteria around when you're eligible for a PCR test, and essentially there's a lot of stress on our healthcare system, including our labs. So we want to make sure that we're using the resources of the healthcare system for the best benefit, and that's the focused approach we've been taking. So I'm worried about our healthcare workers here. Our healthcare workers the system's been under stress for a long time. Certainly the 2 years of a pandemic has put a lot of pressure on the healthcare system. They're tired, and they've been doing everything they can to keep the system kind of going. So we support them in every way we can. And one of the ways we can support them is being very focused on the testing and using those lab resources appropriately. So we're getting there. We'll get through this. We'll get through this wave and the pandemic. There's no question about that. But we need to be smart about it. We need to be respectful of the virus. You have to respect the virus. But we'll get through it. There's no question.
All right. Well, Premier Houston, thanks so much for joining me. And it's been great chatting with you. And yeah, thank you again.
Happy to be here. Thanks for having me.
Thank you.